There is growing evidence that infections from a rare but deadly superbug are on the rise in U.S. hospitals.
Jenna Hanchard spoke with health officials from Kansas University Hospital and is live with details. Jenna.
Good morning, Curtis. Well, the Centers for Disease Control is actually referring to this bacteria as nightmare bacteria. It's called CRE, and doctors here at KU told me that between 2011 and 2012, they had between 5 and 10 cases of these types of infections, and they say that this is the most that they've had at least in 1 year. So keep in mind that CDC data shows that CRE are still very rare, but the CDC, they sounded the alarm because the data shows that the portion of bacteria that have resistance to many drugs has quadrupled in the last decade or so. So while KU doctors told me all of the patients survived, doctors say infections with the bacteria have a fatality rate of 50%.
They consider it a nightmare disease or an infection because it's very hard to treat. There's not a lot of drugs left to treat it with. There are a few, but there's not a lot. So you've eliminated this huge group of very good antibiotics from being useful here.
So the bacteria is really a threat to anyone, but especially for people whose immune systems are particularly low, such as elderly people or children. Coming up in the next half hour, I'll tell you why doctors are really calling this a nightmare. They're saying that antibiotics could be the reason for that, and I'll tell you more about that coming up. Reporting live here at Kansas University Hospital, Jenna Hanchard, 41 Action News.
All right.